Hello everyone! Did you know that migraine is a very common disorder with an estimated prevalence of up to 16% in females and 6% in males? My name is Dr. Alessandro Terruzzi. I'm Head Specialist, Consultant Neurologist and Head of the Neurology Department at Mediclinic Hospital in Dubai. It's a privilege to be here today with you at Migraine Matters, a public campaign to raise awareness about migraine, and I will be here to talk with you and answer your questions and curiosities about migraine management and treatment options. Migraine is not a life-threatening condition, but can be a highly disabling one. You have to consider that with untreated migraines worsening in frequency and severity, the quality of life of the migraine sufferer will be disrupted at home, at work, and at school. Not only, but in the long run, infrequent and untreated migraines can also trigger psychological, emotional conditions like anxiety or depressive disorder. That is why migraine must never be underestimated and have to be promptly diagnosed and treated. First, we have to differentiate migraine from other types of headaches, like tension type headache or cluster headache, which have different characteristics and will need different treatment. Talking about migraine, we consider episodic migraine when the headaches are happening with low to intermediate frequency, lateralized pain, with nausea, sometimes up to vomiting, discomfort to bright lights, loud sounds, or strong smells. And we consider instead chronic migraine when the headaches are happening on higher frequency, more than 15 days per month for more than 3 months in a row with at least 8 strong migraine attacks. There is also another type of quite peculiar migraine, a little bit scary but not dangerous, that is called migraine with aura, where the pain, the headache, is actually preceded, anticipated by long-lasting, persisting neurological symptoms, 10, 15, 20 minutes of shining lights, bright spots, blurred vision that will precede the migraine itself. Whatever symptoms you are feeling, report them to your neurologist. He will provide you the most accurate diagnosis and the most specific treatment. Although migraine cannot be completely and permanently be cured, we can nowadays offer excellent solutions in terms of migraine management. We have new generation anti-migraine medicines that can offer excellent results without any major side effect in a way that was unthinkable in the recent past with the old generation drugs. As headache specialists, we can offer excellent results and improve the quality of life of our patients in a very consistent way. Migraine should be treated in a both non-pharmacological and pharmacological way. Lifestyle changes are necessary to reduce the triggers of migraine, and then we have to consider an acute phase treatment, something to try to stop the ongoing migraine attack to give relief to our patient, and also if the frequency of the migraines is high, a preventive, or as we call a prophylactic treatment to reduce the frequency of migraine and the chances of it from happening again in the following months. Yes, migraine can and should be treated and prevented as much as possible. Taking good care of your lifestyle and starting a preventive treatment when medically indicated are the best way to manage your migraines. Your headache specialist will prescribe to you the most specific treatment, which can be with old generation anti-migraine medicines, basically tablets that you have to take every day for a few months to treat your migraines, or more specific second generation anti-migraine medicines that are able to block the molecule that the brain releases to treat the migraine, preventing them for several months in a row. When migraine frequency is low, or if you are having some residual attacks despite an ongoing preventive treatment, you can be prescribed specific acute phase medications. They can be triptans, specific anti-migraine tablets to stop the migraine attack, or painkillers as rescue medication in case of triptan failure or in case that you have got contraindication to those molecules. Your neurologist, knowing your history and eventually coexisting medical conditions, will prescribe to you the most and safest option. The most important thing is that you do not over-medicate your migraines, you do not self-medicate your headaches. Always refer to a specialist for right treatment. Some preventive medications can have some side effects, especially the older ones, usually mild, but it has to be promptly reported to your treating physician so he'll decide how to manage them. Sometimes reducing the dose can be enough, and sometimes you will need to be switched to a different molecule. The good news is that nowadays we've got a new generation of anti-migraine medications that have much fewer side effects and even better results than before. Actually, there are several non-pharmacological options for migraine management, starting from supplementation based on magnesium or antioxidants, and sometimes referring patients to a psychologist for mindfulness sessions or biofeedback and neurofeedback training, which is a training based on a computer, a machine that will teach you how to manage your pain threshold, and sometimes also advising for yoga, meditation, and physiotherapy referrals. This is a very important topic. Thank you for asking, because lifestyle is paramount in migraine management. Lack of sleep or irregular sleep pattern, oversleeping over the weekends, skipping meals, dehydration, having a very hectic, stressful lifestyle, wrong posture at working place are all conditions that will worsen and be powerful triggers for your migraine. Being able to address and change those lifestyle issues will improve your migraine pattern and will also guarantee a better response and success to pharmacological treatment. In the past, we had very few and limited options to treat migraine, but in the last few years we received new anti-migraine preventive molecules and recently also new acute phase anti-migraine medicines that are able to achieve excellent results with a higher and better safety and tolerability profile. The future of migraine looks much brighter than in the past thanks to medical research. Nowadays we can count on several new options for prevention and acute phase treatment, much more effective, much more safer than in the past, that are able to improve the quality of life of our migrainous patients and also of the family and the people living together with them. Not only, but also new molecules and devices are under investigation to provide a more comprehensive and holistic approach in migraine management, to try to give back a proper and normal life to the hundreds of thousands of people suffering from this highly disabling but underdiagnosed and undertreated medical condition. Thank you for listening, and remember, migraines are not just a headache.